Hello, this is Dr. David Green, Education Director at Premier Pain Specialists in Chicago. Today's topic is what you need to know about spinal cord stimulator implants. Well, first of all, what is a spinal cord stimulator? It has truly been a revolutionary device that is permanently implanted around the spinal cord in an effort to provide pain relief to chronic pain patients. It can work well for either chronic back or leg pain, and actually even neck or arm pain with the latest models. It's considered a last resort treatment as it does involve a slight surgery. It's very expensive for insurance companies, and it should be known right up front that it does not fix the problem the patient's having. It just masks the pain because the problem can't be fixed. So who benefits? It's not a first-line treatment. It doesn't fix the problem. It's an excellent last resort option for such conditions as failed back or neck surgery syndrome, post-laminectomy syndrome, RSD, diabetic or peripheral neuropathy, and even it's being expanded into being used for testicular pain, pelvic pain, abdominal pain, phantom limb pain. So it can take a person with chronic pain, depression, and an inability to work and completely turn one's life around. It's been shown to work well for all those things: back, neck, arm, leg pain. You do have to have a trial placement first, which is a low-risk procedure. It's an excellent last resort option when a person is not indicated for surgery, and it can decrease the need substantially for narcotics. So the steps: a trial implant is placed percutaneously under sedation. You're not put completely out. 2 tiny leads go around the spinal cord. It then goes outside the skin to a programming device with a sterile dressing placed. The pain doctor does need to ask questions while it's being placed to know, okay, does that give you good coverage, yada, yada. And then it's worn 5 to 7 days to see if it's going to work. It can be removed just right in the office with the leads being pulled out. If a person obtains over 50% pain relief, then it's considered a positive result, and then a person goes on to receive a psychological evaluation to get approval for the final implant. Now, how is a final implant placed? Well, it takes about an hour. It's placed completely under the skin. It consists of a large paddle lead for better coverage. The latest ones have over 200 programming options available. The pain doctor or the neurosurgeon, whoever's doing it, makes an incision and then a small bony removal so the paddle lead can fit. And then the leads are tunneled underneath the skin to a battery which is placed subcutaneously either above the buttock area or around the abdominal regions. The latest ones are rechargeable through the skin, so they have a much longer lifespan. And it used to be that the old ones lost coverage from when a person went from a laying to a standing position. That no longer occurs. How well do they work? Well, there have been lots of studies done. One of the largest was done by St. Jude's. They showed 84% had life greatly improved with all types of chronic pain conditions. Another one in 2006 showed 77% good to excellent pain relief. Another one showed 85% excellent outcomes with diabetic neuropathy. And 58% of those patients in that study had complete restoration of their sensation deficits. And then there's been a study in 2000 showing that spinal cord stimulation works extremely well for RSD as well. You can see how small these things are now with the battery and programming device. Look at that's a quarter. Look how small that is. They're very thin too. This is what the paddle leads look like. The latest ones have lots of diodes in the paddles, so that contributes to a ton of programming options. What are the risks? Well, the device may stop working. It can migrate, there can be an infection, there can be some bleeding, there can be wound breakdown when it's placed. But the biggest risk is that it may stop working after a couple years. The top non-operative pain management in the Chicagoland area is with Premier Pain Specialists. There are several clinics in and around the city, accepting over 50 insurances and providing over 25 different treatment options, and they are experts in spinal cord stimulator implants. Very high success rates with the board-certified award-winning providers. Visit us online today at ppschicago.com and then call us for more information and scheduling at 847-220-7907. Thank you very much for watching.